As a woman, you might be wondering, how will prednisone affect me? If prednisone is a steroid and my doctor is prescribing me a steroid, am I going to become like a Hulk or like a bodybuilder, wrestler, somebody who hangs out in the gym all day? My doctor gave me this medicine to make me feel better, not to look like a man. Is that what's going to happen to me? So, today we will discuss how prednisone affects women and things that women should look out specifically. The first thing we need to understand is that prednisone is a steroid, but not the same kind of steroid as what the bodybuilders use. So here you can see that there's prednisone on the left, and on the right are a whole bunch of different hormones that are in our bodies. There's cortisol that prednisone is mimicking in the top left. And then at the bottom down there are sex hormones. So progesterone and estradiol are the female hormones. Progesterone is really high during pregnancy. And then there's testosterone, and that's the male hormone. What we need to understand about all of this, I'm not going to make you memorize these structures and have to draw them like I did in pharmacy school. But what I want you to see is how similar prednisone is to these other hormones. Therefore, what happens is your body can sometimes get a little bit confused, mixed up, and might just start treating prednisone like these other ones. There's a cascade where these all change into each other back and forth when your body needs them. And so sometimes it gets a little out of whack when we're on the prednisone. Sometimes it feels like we have too much progesterone or too much estrogen or too much testosterone than it normally would. And so that is going to be the foundation for understanding all of the other things that happen throughout the rest of this presentation today. So prednisone affects women differently than men. The side effects can be on female-specific issues, and women get different mood issues than men. Women have different effects on their hair and on their bones. We'll start with the female issues. So, females are the only ones who menstruate and are pregnant or breastfeeding. And we'll go into each of those in depth next. And then breasts. Women report when they're gaining weight because of prednisone that it makes their breasts get bigger. Other women find that their breasts shrink. Other women report having more tender breasts than usually. So menstrual changes. Essentially, anything can happen to your period. You can have dysmenorrhea, which is when you have painful or extra bleeding or longer periods than usual. You can have amenorrhea, which means you go without having a period. And finally, you thought you were done, you thought you were out of the woods, that you were post-menopausal, and then prednisone gives you post-menopausal bleeding. Now, with everything I say today, clearly you can't have all of these happen to you. You can't have dysmenorrhea and amenorrhea at the same time. So this doesn't happen to everyone. None of these happen to everyone. And they're not that common. All of these female-specific things are relatively rare side effects that people experience. But my purpose in this presentation is for you to understand that you're not alone, that it is possible. You're not going crazy. You're not suddenly going back into menopausal bleeding. It's just the prednisone. So, feeling like you're in menopause is possible. I am clearly not in menopause, but I felt like I was going through that change because I had hot flashes, I had sweats, I had mood swings, I had that beautiful flushing of my cheeks and chin. And you can tell I have no makeup on. I'm not using a filter of any kind. And so that's me in the real deal with nothing. I was having clearly hot flashes and it was no fun. All right, another female issue, pregnancy. So a lot of women are worried, can I take prednisone while I'm pregnant? And the drug companies have this tiny little asterisk saying that there's a slight risk of cleft palate in the first trimester. And while this is true, usually if somebody's taking prednisone, the benefit of taking prednisone far outweighs the tiny risk of cleft palate. And because of that, the doctors who take care of pregnant women, the American College of Gynecologists, say that prednisone is the recommended drug to treat certain diseases in pregnant women. So if they think it's worth it, then I agree with them. They're the experts. I'm just telling you what they said. Or what about breastfeeding? So I actually had to deal with this. When I was prescribed high-dose prednisone, I was 9 months into feeding my fourth child, and I was surprised that I was being prescribed prednisone. So I actually had to look it up to make sure. So I recommend that every woman who is breastfeeding and is questioning whether their drug is safe while they're pregnant, download the LactMed app. It's written by the American National Institutes of Health, and it gives really great information about what drugs do, what has been reported about the drugs. So LactMed said that the amounts of prednisone in breast milk are very low. No adverse effects have been reported in breastfed infants with maternal use of any corticosteroid during breastfeeding. And so I said, great, I will take that prednisone so that I will not bleed to death. And they had me staying in the hospital, and I was away from my baby, and it was really rough trying to figure out how to get that milk to my baby. And the nurses were fantastic, and they helped me succeed in continuing to breastfeed even though I was hospitalized. What I didn't realize was that next bullet right there. I kind of skimmed over that a little too fast, where it said, high doses might occasionally cause temporary loss of milk supply. So the first time I was on prednisone, I was on a high dose. The second time I was on a drug very similar to prednisone called dexamethasone, and I was on incredibly high doses. I'm talking 10 pills a day of the highest strength for 4 days. And that's like 160 milligrams of prednisone. I was on that for 4 days, and it completely shut down my milk supply. I was like surprised that I couldn't give my baby any milk. And so it shut it down, and I had to stop breastfeeding, and it was very sad. Even though the next bullet says the American Academy of Pediatrics says that prednisone is compatible with breastfeeding. So the doctors who take care of the babies say that mamas can be taking prednisone while they're breastfeeding. So I feel pretty good about that. If the doctors that take care of the babies say it's okay for breastfeeding, and the doctors that take care of the mamas say it's okay for pregnancy, then I agree with both of them. All right, now moving on to other side effects and how they affect women differently than men. So they've noticed with mood side effects, things that are psychiatric, that women tend to have more depression than men, and men might have more mania or delirium. And then women generally have more psychiatric side effects than men. So men might take prednisone and be like, it wasn't that bad. And then a woman takes it and feels like she's going crazy. But it's not her, it's the medicine. So you are not going crazy. The medicine is giving you a side effect. Excuse me. Okay, so hair. This question comes up a ton. Can prednisone cause hair loss? And it seems rather controversial because there's not a lot of evidence in the literature about this. But essentially, yes, prednisone can cause hair loss. For me, I lost a third of my hair after I stopped taking prednisone. So I finished prednisone in June, and then from August to September, every time I washed my hair, I would lose an entire brush full of hair. It was amazing. And so it's been a year since then, and now my hair is growing back, and there's this strange thickness at the top where it's thinner at the bottom. So yes, alopecia or hair loss can happen. It doesn't tend to be bald spots like when you hear with chemotherapy where an entire lock of hair falls out. It's more like thinning. It's more you lose the thickness of your hair, but the thickness will come back. All right, then hirsutism, that's a fancy word that means facial hair. And women will talk about peach fuzz or bigger sideburns than usual or having to shave their face for the first time ever. And that is related to that testosterone. Both of these hair issues are related to the testosterone hormone changes because of the prednisone. Another person posted recently on the Facebook support group asking if prednisone could cause testosterone levels of 0. And yes, that is possible. And so if things like that are happening, you can supplement. Like you can give back testosterone. You can give back female hormones if they're too low. So you could go on birth control pills or hormone replacement if they are being lowered by the prednisone. All right, finally, bones. This is by far my most important one to me. So prednisone is leaching calcium from bones. And everyone on prednisone should worry about this, but the people who should worry about it the very most are post-menopausal women. So women who have gone through menopause and are taking prednisone, they have a much higher risk of osteoporosis than any other population. And so every single postmenopausal woman on prednisone over 7.5 milligrams should be taking calcium and vitamin D daily. And it's because it can lead to osteoporosis, and the most terrible is avascular necrosis, which is bone death. And this person's x-rays, you can see here, they had to have their hip joint replaced because of avascular necrosis, which is terrible. We don't want to do that. So what can we do about all of this? So you can go to prednisonepharmacist.com and you can get your own Prednisone Wellness Checklist. And it has a list of ways to look out for these issues, ways to cope with anything that is affecting you from prednisone, resources for you to check out. And so if you'd like that, go to prednisonepharmacist.com. I'll put a link below. And I'll talk to you next week. Signing off as Dr. Megan, your prednisone pharmacist.